Hi, I'm Dr. Stephanie Davenport. I'm one of the Pediatric Emergency Medicine Physicians at CHEO. And today I'm going to talk to you about different kinds of infections that we see every day in the emergency department. By infections, I mean things like coughs and sniffles, vomiting, diarrhea, and of course, fever. Many of these types of infections can be managed safely at home, so here are a few tips of things that we want you to know. In terms of cough and congestion, we see a lot of kids that come for concerns about these things at CHEO. In general, these do not need to be seen in the emergency department. Cough and congestion are mostly caused by viral infections, which never require antibiotics. In terms of cough can last for a long time. We often see concerns about coughing so hard a child vomits or coughing a lot at night. If your child is otherwise well and they don't have a high fever that lasts for more than 5 days, this cough is most likely related to their viral infection. Cough can be managed at home by really good hydration, and if your child is older than 1 year of age, you can give them some honey, which can often help to soothe the throat and help with cough. If your child is very little and they can't clear their nose by themselves, it's possible to use a snot sucker to help them to clear these secretions. This can help significantly with their ability to breathe and to drink. Vomiting and diarrhea is another reason that we see children every day in the emergency department. Vomiting and diarrhea are also mostly caused by viral infections in children. This can be managed by really good hydration at home. Often when children have vomiting and diarrhea, they have difficulty consuming a large amount of fluids, but we need to be a little bit tricky and give them things like popsicles, jello, and juice, which can give them a little bit of hydration and sugar to help sustain them. Especially with young children, having some kind of fluid with a little bit of sugar in it is important. Small sips regularly is more important than a large volume all at once. And of course, watching to see how much your child is peeing is really important. We would expect your child or adolescent to have at least 3 wet diapers or pee 3 times in a 24-hour period. Lastly, fever is a very common reason that we see children and youth every day in the emergency department. In general, fever can be treated at home as long as your child is otherwise well. You can treat a fever with Tylenol and Advil to make them feel better, but it's not necessary to treat a fever. Fever in and of itself is not an emergency. If you treat your child's fever with Tylenol and Advil and they are playful in between episodes of having a higher fever, this is very reassuring. Tylenol and Advil do not hide a serious reason to have a fever. Here are a few reasons for when we really need to see you in the emergency department. If there's ever blood in the vomit or the diarrhea, or they are vomiting so much that they are not able to take any fluids in, this would be a reason that we would need to see your child or adolescent in the emergency department right away. If your child has significant distress or looks like they're using all their muscles to breathe, the cough is associated with a fever that lasts more than 5 days, or your child appears unwell, we should see them in the emergency department right away. The reasons that fever should be seen in the emergency department are specifically if your child has a decreased level of consciousness or appears unwell, and especially if they are 3 months of age or younger. These children need to be seen in the emergency department. Otherwise, if your child is well but has fever that lasts more than 5 days, they should be seen by a medical professional. This does not necessarily mean at the emergency department. Ultimately, you know your child best. And if you're worried, we are always here to see your child. We know how precious your children are, and as parents and healthcare workers, we're always here if you need us.